Joining me now is Dr. Jennifer Kwan. She's a family physician in Burlington, Ontario. She's also been charting the Ontario cases of COVID-19 to see where that curve is and whether or not the curve is actually flattening. Dr. Kwan, great to have you and to get your insight here on CTV News Channel. So your thoughts, where we're at. We recorded more cases today in Ontario, sadly, more deaths. Are we getting to that point where perhaps we're at that peak and then sort of leaning towards flattening the curve in Ontario, or are we far from it right now?
So you bring up a very good point that we have had a record high number of cases today. However, we have also increased our testing up to approximately 8,000 tests a day. So when you do increase the number of tests, you will also see increased number of cases, whereas you may not have captured those cases with fewer tests previously. Additionally, with the new deaths is definitely a major concern. Many of these deaths are actually concentrated in long-term care homes, retirement homes, and other vulnerable populations. So even though we are seeing more deaths, we have to identify where the deaths are and target those communities in order to provide them adequate support. So despite these increases in numbers, we are also keeping an eye on hospitalizations, ICU admissions, and intubations, and those numbers have been very relatively reassuring for over the past week.
And I think you made a really excellent point there, because though we were looking at number of cases, we need to break down exactly what those numbers actually mean when we're talking about mild versus those who may be in hospital or in ICU. I want to bring up a graph. We may have been just showing this to our viewers now, but I'm hoping you can break it down for us a little bit. This is from Public Health Ontario. We want to get your sense of what your takeaways are on this. Again, there's that graph there we've been showing our viewers based on what the numbers are when we're looking at, you know, the surge in cases versus the number of hospitalizations versus the number of deaths.
Yeah, so usually there is a little bit of a lag time. From infection, there is approximately, 5 days or up to 14 days for people to develop disease. And then there's a few more days, maybe 7 to 10 days, where people either recover or can decline rapidly to hospitalization. That means that they can also get sick earlier on in this disease trajectory. And then when people are hospitalized, they may or may not need ICU depending on their status. So the numbers for hospitalization and ICU admissions do lag behind the cases a little bit. However, they are more representative of the true burden of disease in our community.
You know, a big question people keep asking is, when can we get back to normal as a family doctor? And of course, you're dealing with patients in whatever capacity you certainly can, whether it's video conferencing or over the phone or whatnot. What are you hearing from them? And I guess, what's the advice you're giving them?
So a lot of my patients are very anxious. People have plans for their lives. I understand people are very frustrated to be home for so long and hearing that the vaccines may take 12 to 18 months for development. I did write an article recently. It's entitled How to Spell Pandemic Without Panic. So DEM is distancing, which everybody is doing great, easy testing, and masks. So if we can implement fast, widespread, easy testing, as well as have universal masking, that will enable us to have additional protection and hopefully help us to get back to our new normal in approximately 3 to 6 months.
Dr. Jennifer Kwan, it's great to have you on the program, breaking it all down for us in the best way possible to ease our anxiety on this. But again, as you mentioned there, the numbers show there are a lot of cases that are recovered, and majority of those cases are mild. Dr. Kwan, thank you very much for this. We appreciate everything that you do. We wish you and your family well.
Thank you. You as well.